Welcome to the Birth Lounge Podcast, an empowering space for expecting and new parents to hear candid conversations with experts, support your mental health, and learn the tips and tricks that thousands of parents have used to craft their ideal birth. We will answer all of your questions, the scary ones and the weird ones, to help calm your fears and feel confident going into your birth. I'm going to help you redefine what birth and motherhood looks like and how to embrace your journey. I've intentionally crafted a list of experts to help you navigate pregnancy, explore your birth options, and plan for postpartum so that it can be a time of soaking in your tiny human. We're going to go there on all the hard topics so that you can dive deep into finding your confidence and freeing yourself from fears around birth. With over 10 years of experience in family education and a master's degree in human development and family studies, I created this podcast as a way to share the resources parents need to make educated and informed decisions about their care in pregnancy and childbirth. This is a birth community driven by evidence-based information and research in hopes to help you explore your options, understand your rights, and know what choices you have along the way when it comes to birth and beyond. I'm your host, HeHe. Now let's get to the good stuff. Dr. Wattles, welcome to the show.
Thank you so much for having me. I'm so excited.
Absolutely. So I am really excited for this episode, partly because I typically know pretty well the topics that we're talking about. I typically have pretty deep knowledge about the things that we chat about on the podcast. But today, I don't know very much about fertility. Is a realm of reproductive health that I'm just now getting into. And I think the mitochondria is a kind of mysterious thing. Obviously, we all know the mitochondria is the powerhouse of the cell, and that's what has been drilled into our head. But beyond that, I don't know that a lot of us actually understand A, what the mitochondria is and does, and then B, what does it actually have to do with our fertility? So before we jump into the fertility stuff, let's start at the very basics. Would you mind breaking down what our mitochondria is? What is its function? Why do we have it? Why do we need it? And then we can dive into how it plays a role in our fertility.
That's great. Like, why do we care about this
Yeah.
mitochondria thing? I love that you mentioned the powerhouse of the cell because I sometimes joke we can all hear our 10th grade biology teacher say,
Yes.
mitochondria are the powerhouse of the cell. Mitochondria must have the best PR team that we're all carrying that 20 years later and we remember. But it's so true. Let me tell you a little bit about what that actually means. So our mitochondria are these tiny structures that are found in most cells of our body. And like you said, they act as the powerhouse of the cell. And this isn't just a fun fact from biology class. It's actually really crucial to the way that we generate energy. So these tiny little structures, they are going to produce energy, cellular energy, in the form of ATP, which I call our energetic currency. And that's going to power almost every cellular activity. And we can think of mitochondria, I like this mental model, as cellular batteries because they are going to convert the energy from, let's say, the food that we eat into a form of energy that our cell can use. And if we think about something as energetically expensive or intensive as building a human from scratch, creating and nurturing new life, you can bet that mitochondria are front and center of importance. And they're really critical in our ovaries and early stages of fetal development. So I like to share this fun fact to put this all into perspective. Our egg cells have the highest concentration of mitochondrial DNA in the human body.
Wow.
And just to put this in perspective, that is 1 to 2 orders of magnitude higher than other cells that we might think about as being really energetically dependent, like our muscle cells or our neurons. So our egg cells, they are very mitochondrial rich because we need so much energy. I describe ovulation, fertilization, implantation, early embryo development as being a very energetically expensive process. So our mitochondria and the energetic currency that they create is what you can say it's what pays for those energetically expensive processes.
And so how is that going to play into our fertility, especially if our eggs are designed to be mitochondrial rich and they're designed to do this energy rich process,
Mhm.
what does this have to do with our fertility? Because in my mind, they're designed to do that, so that's what they're going to do. But that must not always be the case.
It's not always the case. And I think the most maybe profound or visible example is our mitochondria. They tend to lose some of their function just as we get older.
Hmm.
And I feel really passionate about reproductive longevity. And we have this myth of the fertility cliff, right? Like 35, we wake up on our 35th birthday and all of a sudden we're infertile.
Infertile.
Absolutely not. That is not how this works. But part of the reason why we see a decline with fertility as we get older is because our mitochondria lose a little bit of function. We have less mitochondrial DNA. We have more mitochondrial DNA mutations. So our cellular energy production just doesn't work as efficiently.
Mhm,
Now, in
mhm.
someone who's younger, we can still see issues with mitochondria because of things like chronic inflammation or oxidative stress. And we can dive into all of that a little bit more. But when our mitochondria aren't functioning well, we can lose some of our reproductive function in either we're not ovulating as regularly or our egg cells just aren't as healthy. So maybe they're not fertilizing, or maybe they fertilize, but they don't then really mature, get our period at the same time that we normally would. It's not implanting properly. So I like to tell, if it's okay with you, I like to tell, I call it a love story between our mitochondria and our granulosa cells, which are cells in our ovaries. Is it okay with you if I take a moment and tell this love story?
Of course, if anyone loves love, it's me. I'm a hopeless romantic, so go for it.
We love love, and this is just very love centered. So, first, let me tell you about granulosa cells. This is like the nerdiest thing, but I have a deep love for granulosa cells. I think a lot of scientists, a lot of docs, we have our favorite cell type. Granulosa
Okay.
cells are mine.
I've never even heard of that type of cell.
I got you. I'm going to give you some background. Granulosa cells represent the largest cell population in our ovary. There are these specialized cells that are located in our ovarian follicles. So in our ovary, we have follicles are essentially the egg sac. Our egg cell is swimming around in these little sacs. They have fluid, they have antioxidants, they have hormones, things that nourish egg cells. So our granulosa cells are the major cell type that makes up those egg sacs. And so sometimes we'll call them the egg cell, the nourishing cells, or the egg cell support team. I think it's cute to think about these cells that are there for the sole purpose of receiving hormonal signals from the brain, keeping our egg cells nourished and growing and happy. During ovulation, our mature egg is released from the follicle. It bursts and ruptures from that follicle that's made of those granulosa cells. And then the remaining granulosa cells form a structure that's called the corpus luteum. And the corpus luteum fills with fat and it starts to pump out progesterone. And that progesterone sustains the endometrium, which is that inner lining of the uterus, during the luteal phase and in early pregnancy until kind of the placenta takes over and then we have really robust progesterone. So the corpus luteum is responsible for making progesterone. Here's where the love story between the mitochondria comes into play. So like we said, our mitochondria are generating all of this cellular energy. We can think of them as cellular batteries. The growth and the proliferation and the division of our granulosa cells requires abundant and stable mitochondria to supply appropriate amounts of energy so that they can support our egg cell.
Hmm.
So when we have mitochondrial dysfunction because of we have a lot of inflammation or we have insulin resistance or we have a lot of chemical exposures, oxidative stress, it can disrupt this bidirectional communication between our egg cell and their support team, the
Hmm.
granulosa cells. And that can lead to stagnant cell growth and kind of a lack of egg cell maturity. So if I have patients who they have luteal phase dysfunction, meaning they have a very short luteal phase, the luteal phase being the time from when you ovulate until the time of your next period. If that is very short, I'm thinking, what's going on with the mitochondria?
Wow.
If you just have a low progesterone, so I'm measuring a serum progesterone, so progesterone in the blood a week after ovulation, if that's low, I'm thinking, what is going on with the mitochondria? Because we know we need that mitochondria to make progesterone. So it can show up, mitochondrial dysfunction shows up in a lot of different ways in terms of the health of our egg cell. The other cool fun fact is that Mitochondria are located in the middle of a sperm cell in their tail. So sperm use their tail as like a propeller. It's what helps them swim forward in a roughly forward motion. If you've ever looked at sperm cells under a microscope, sometimes they chase their tail, sometimes they're not going appropriately, but mitochondria are what power that forward motion. So as I'm working with my fertility patients, we're getting mitochondrial support on board for both partners because it's so crucial for both egg and sperm health. That's the love story. There's actually multiple love stories I think I just told.
No, but that really breaks down all of it. Very simple. I was able to follow that so easily. And I'm wondering, are there certain miscarriages or losses that clue you in to, yes, we should definitely be looking at your mitochondria? And then are you, as a practitioner, seeing as reproductive endocrinologist doing this mitochondrial work, or are you finding that there's a gap in care and a lot of REIs really aren't looking so much at our mitochondria?
Yeah, so this is an emerging field that I would say the whole field of reproductive endocrinology and even reproductive immunology, I think is catching on to how important mitochondria is. And when we look in IVF studies, there have been pretty firm conclusions that the success of embryo development is directly related to its ability to make energy through its
Wow.
mitochondria. So there's so many things I want to say about this. The first thing I'll say is if someone has unexplained infertility, which what a frustrating diagnosis, right? I'm always thinking about mitochondria. And I have every single one of my preconception patients on some mitochondrial support, both men and women.
Oh,
So I'm just going to throw out CoQ10 is my number one. I have everyone on CoQ10. CoQ10 is an antioxidant. It's also a powerful mitochondrial support. So I have people work their way up to 600 milligrams of CoQ10. They usually start with 200, do that for a week. If that's okay, they move up to 400. If that's feeling good, they move up to 600. And we see CoQ10 really supporting our mitochondrial function. And that is pretty standard. I think a lot of REIs are going to recommend CoQ10 because it's so well researched in terms of supporting pregnancy outcomes. When my patients have, like I said, unexplained infertility or they have recurrent pregnancy loss, I'm really thinking about what's going on with the mitochondria. If someone's going through IVF and they say they retrieve a bunch of eggs, this happens to my patients all the time. They'll get a bunch of eggs in their egg retrieval, but none of them will grow out to maybe they don't fertilize or they do fertilize, but they don't make it to that day 5 blastocyst stage. That is an egg health issue. So we are going to dive deep into our mitochondria. And there's so many different therapeutics that we can bring on. I'm lucky here in Seattle. I think that there's a pretty robust integrative fertility community. So maybe 50% of the patients in my practice are going through IVF. And there does seem to be a lot of collaboration with the REI saying, I'm going to do what I'm going to do, and you're going to handle the mitochondrial stuff, the lifestyle, the nutrition, the supplements, and we're going to really work on egg health, getting ready for our next IUI or egg retrieval for IVF. So the last thing I'm going to say, if anybody likes to read research, there's this emerging technology. It's not so much new anymore, but it's not super common. I would say it's still in its infancy in terms of interventions, but it's essentially a mitochondrial transplant. It is a transfer where if someone has poor mitochondrial integrity, you can take mitochondrial DNA from a third party and transfer it into an egg cell. And it's pretty controversial because it's almost like a third parent, but it is a thing that it exists. And more, I think, really proactive clinics are doing mitochondrial transfers.
what does that procedure look like? I'm very familiar with retrievals and I'm very familiar with transfers. I'm very familiar with IUIs and the IVF process. What does a mitochondrial transfer look like?
Yeah, I'm not an expert in the actual procedure, but from what I understand, it's isolation of the mitochondrial DNA in the lab. And then by some mechanism, I picture it, if anybody is familiar with ICSI, which is
Mm-hmm.
intracytoplasmic sperm injection, where you just suck up one sperm in a little tube and then inject it into the egg. That's how I picture it. I'm actually not exactly positive how that procedure goes. I imagine a very precise science of isolating that DNA and transferring it into the egg cell. perhaps we need to do a whole episode dedicated to just these emerging technologies, because I think this is the future of reproductive medicine.
And you think that maybe by doing this, we could really improve people's outcomes with IVF, especially the folks who maybe have had several rounds of unsuccessful IVF?
Absolutely. But I think the mitochondrial transfer is probably going to be most indicated for people who have some kind of frank mitochondropathy. So that means something genetic, there's an actual diagnosable condition that is affecting the mitochondria. Oftentimes, like I said, this is a genetic situation. For most of us, we have the potential to have healthy mitochondria, but there's lifestyle, environmental factors that are interfering with our mitochondrial health. So things like insulin resistance is a big one. I think
Okay.
about this all the time. Such a high percentage of my patients who've been diagnosed with unexplained infertility have insulin resistance or hyperinsulinemia. When we have a lot of insulin or a lot of glucose in our bloodstream, it creates quite a lot of oxidative stress. Oxidative stress describes damage to our DNA. Oxidative stress can really impair our mitochondrial DNA. And so it might be, we don't have to do something as drastic as like a mitochondrial transfer. It's getting our blood sugar under control, increasing insulin sensitivity, reducing that oxidative stress that is generated by the hyperinsulinemia. We know that things like environmental toxic exposures can damage our mitochondrial DNA. So I use a tool in my practice. It's called the Toxin Exposure Questionnaire. I try to get to the root of where people's toxic exposures are, reduce those, do a gentle detox if I need to, just to eliminate some of those compounds. And then we could get into a whole conversation about the role of chronic inflammation, because when we have chronic systemic inflammation, that can also really impact, number one, our mitochondria. Number two, when we have inflammation, no matter where it comes from, once it gets into our systemic circulation, it can go anywhere. And that includes our ovaries and it includes our endometrium. So if we have a lot of inflammation because of insulin resistance or because of gum disease, this is one people I think don't think about very often, or we have an infection in the gut, that can travel to our ovaries where we get so much inflammation in the ovarian tissue that the tissue wastes away, and then we're going to have less egg cells. We're going to have less robust progesterone production because that tissue is so inflamed. But keeping it to the mitochondria, chronic inflammation can damage our mitochondrial health. So just getting a sense of where inflammation is coming from. We can talk about how I test inflammation if you want to do that, would be good. And then sleep. Like sleep is an maybe underappreciated contributor to our mitochondrial health. We need to have sleep. I always say, if we can have 8 hours of sleep, hopefully we're all getting that. But the rule for me is you're in bed in complete darkness before 11 p.m. because our natural melatonin is going to surge between 11 p.m. and 2 a.m. And melatonin is extremely protective against oxidative stress, and it's one of the most important mitochondrial support nutrients. I use melatonin in my practice. I know that there's some controversy about melatonin. I feel very comfortable with a low dose of melatonin every night, taken around 9 p.m. It's so amazing to support the health of our eggs, to support the health of our placenta, but also doing the lifestyle factors that we can to support healthy sleep. So we may not need anything heroic to support our mitochondria. It's lifestyle, it's good nutrition, it's targeted supplementation.
What is the controversy around using melatonin? I think a lot of people feel that melatonin is very benign. I also find that people are not aware that it is a hormone. People
Yeah.
often don't think about that. So it is a hormone. Is that why it's controversial? Is because it's somewhat of a hormone, not replacement, but supplement almost?
Mhm. Yeah, I think that it's a two-part thing. Number one, people, every time I post about melatonin, so I'm just going to come out and say, I personally have been taking melatonin every night for probably the last 3 years.
Wow. Okay.
And the reason I did that is because all of this research has come out about the role of melatonin in supporting ovarian aging. And I'm 36. I have 2 children, but sometimes I wonder if I want another baby. And so I just want to support the health of my ovaries so that I can still decide if I want to have another baby. So I really focus on the health of my ovaries. And some research has come out saying that one of the main drivers of aging in the ovaries is oxidative stress. And we should consider melatonin as a first-line therapy for reducing ovarian aging. Now, the controversy that I hear often when I share about this on social media is that many people have heard that if you take melatonin long term, it will shut off your body's own production of melatonin. Debunked. This has been debunked as far as I'm concerned. We have studies that are looking at the use of melatonin nightly for up to a year, and we see no adverse outcomes on the body's own melatonin production. And that's even using doses of 4 or 5 milligrams. So just to put it in perspective, I'll use a dose of 0.3 to 3 milligrams. So I think 0.3 it's what we call a physiological dose. It's similar to what your body would make. I do that every night. If I'm traveling, if I feel any kind of circadian disruption, I'm going to go up to the 3 milligram dose. I do it all the time. And I feel really comfortable. I feel really confident that can be used safely. So that's the first controversy is people think it's going to inhibit your own production. I don't think that's a thing anymore. We've proven that. Number 2, people have read on the internet that melatonin will inhibit ovulation. If we go back in the research and we look, there were studies like 30, 40 years ago, I want to say, and they did show that high dose melatonin could inhibit ovulation. Just to give some perspective, these studies were using doses of 300 milligrams of melatonin. Sure, I'm sure that did have an effect. That is so much higher than the 0.3 to 3 milligram dose that I am recommending. So I'm not surprised that a huge super physiological dose had an effect. I have never seen an issue at lower doses. I feel super comfortable with this. I use it in my patients all the time, and I think it's one of the most powerful antioxidants that we have, and what a great benefit that it also helps us to sleep more deeply. The last thing I'll say is I talked about that follicular fluid, which is the soup that our egg cells are swimming in. Melatonin concentrates in that follicular fluid. It should. It's supposed to be there as an antioxidant to protect our egg cell. And they've done some really cool studies in an IVF setting where they gave women who are going through IVF, they gave them melatonin starting at around cycle day 4 or 5 until roughly right before ovulation. So mid-cycle or early follicular to luteal phase, they were taking melatonin at a dose of around 4.5 milligrams. And what they found is that they had this massive increase of melatonin in the follicular fluid. So an oral melatonin supplement was effective at raising the melatonin in that follicular fluid, and the women that took the melatonin had better pregnancy outcomes. I'm a fan. All of that to say, I'm a fan.
Okay, what kind of better outcomes did we see?
In this this setting, it's just clinical pregnancy rates. Did their IVF cycle result in a pregnancy? And that is limiting, right? Because a clinical pregnancy doesn't necessarily mean we had a healthy baby that was born, right? So we had to take it for what it is, but we did see more clinical pregnancy rates.
And what about people who work shift work or work overnights? What should
Yep.
they be thinking about? Because that's on my mind as a doula who works overnights. I'm thinking, especially as I get closer to growing my family, I'm thinking, okay, what do I need to be doing for my body to support that since my lifestyle can't exactly change? That's my job. I'm thinking overnight nurses and physicians as well.
Yes. So this is hard, and I'm just going to say that there's no way I can sugarcoat that when we have disruptions to our circadian rhythm, it's tough.
Hmm.
Because our reproductive hormones are secreted in a pulsatile manner that is influenced by our light and darkness cues.
Okay.
This comes up in my practice. I have a lot of nurses, I have a lot of
Hmm.
other physicians in my practice, and sometimes we have to make a change to our schedule in the
Yeah.
3 months or so before we're trying to conceive
Okay.
in someone who's not ovulating regularly. This obviously doesn't happen to everyone, but when we have this disruption in our circadian rhythm, it can make us more insulin resistant. So let's give an example of if you have existing PCOS, so you're already not ovulating very regularly, and then you're also working a night shift, that is going to make it much harder for me to get more insulin sensitivity. So sometimes in those situations, we have to make some decisions that are very hard. For people who are ovulating regularly, they have healthy levels of hormones. I say the best thing that we can do is be as regularly irregular as possible. So if you're working night shift, at least having some regularity, like you work night shift these 3 nights and then you're on a normal shift to the next 4 and then it's back to those 3 nights, like having this regular irregular pattern is better than something that's totally random. If you're a doula or a midwife or an OB and you're delivering babies and we have no control over when they come, we do our very best, right? You try to keep your schedule as regular as possible on the days that you can. So for me, I like a sleep schedule that is 10 to 6 or 11 to 7.
Okay.
That is going to maximize our melatonin production. It's going to help us to follow those light and dark cues that help our brain and our ovary communicate. You just do your best as regular as possible. I love the idea of melatonin around 9 p.m. It's not sedative. I want to say that about melatonin. Melatonin is not sedative. It just helps you to reach a deeper sleep once you're already asleep. And then we can talk about maybe there's some other mitochondrial support that you'd like to use just to prepare. I mentioned CoQ10 is one of my favorites. N-acetylcysteine is another favorite of mine. NAC is so amazing too because it's a mucolytic. It thins mucus. So for those who really want to support their egg white cervical mucus, NAC is an excellent choice. I dose it at 600 milligrams 3 times per day. We talked
Wow.
about melatonin, L-carnitine, alpha lipoic acid, NAD. There's so many choices.
And how would somebody know which supplement is right for them? Or is it typically you need multiple supplements? And so we see people on all of these.
It depends, and it's fun. I think it's fun developing a supplement routine, and there's a couple things we can do. So number one, I do a test in my practice that's called the NutrEval. It's by a company called Genova. I think a lot of functional practitioners, this is beloved to many of us because it gives us so much information. I will say when I did the NutrEval for myself the first time, I have a nutrition degree. I'm a naturopathic doctor. I thought I've got this all. My lifestyle is so good. But I also was like working 60 hours. I had a toddler. I had a new baby. This thing was horrible when I did it on
Mm.
myself. So all of that to say, sometimes testing surprises us, which is why I like it. It's like the test, don't guess philosophy, right? So we can do that, and that's going to tell us things like our total antioxidant capacity, which antioxidants are the opposite of oxidative stress. They protect us from oxidative stress. So we can look at total antioxidant capacity. We can look at our fatty acid profile, which is so important for our mitochondrial, the membranes that make our mitochondria. We can look at really powerful antioxidants like glutathione that also concentrate in our follicular fluid. It helps us to personalize our supplement dose, but it's expensive. It just is. The testing is expensive. So sometimes I'll bring on CoQ10 for basically everyone. And then I try to pick and choose based on other things that are going on in someone's body. So I mentioned NAC. I'll choose that one also if someone, like I said, wants to support their egg white cervical mucus, or if they have insulin resistance or PCOS. NAC can be really helpful to lower hyperinsulinemia, so I'll use it there. Melatonin if someone needs help for sleep, or if they want to support their reproductive longevity, I'll use melatonin. So I think it's really taking this look at what's your diet, what are your goals, and then we customize a protocol.
Would the Dutch test give you any sort of insight into what an appropriate supplement routine would be for somebody?
It does in that the Dutch test and the NutrEval actually, they'll measure something that's called 8-hydroxydeoxyguanosine, which is a marker of mitochondrial DNA damage. And so if we see that's elevated, we're like, oh, we need a lot more antioxidants here. And so it doesn't tell us exactly what supplement to take, like the NutrEval, which tells us all these nutrients and then the exact dose that you need to replete. But it is great information because then we know, oh, our mitochondria need a little TLC.
Yeah. Okay. And in terms of that oxidative stress and the toxin exposure, talk to us a little bit about like fragrances,
Yes.
candles, laundry detergent, plastics in our home. What are we seeing in terms of that? Because I know that There's a lot of things online, especially from your crunchier groups, which I definitely identify with in some regard. It's all about get rid of the plastics, go all glass, get rid of all fragrances, stop wearing
Hmm.
perfume, get rid of candles, go all soy. How important is that in terms of protecting and or improving our mitochondrial health?
Yeah, it's important and it's hard. I just want to recognize how challenging this is. And I think it can be so incredibly overwhelming if we don't
Mhm.
take it in bite-sized pieces. So I usually tell people, start with the things that have the biggest impact. So for me, I think about shampoo, conditioner, and body wash because this touches our whole body.
Every day.
It touches our entire body. We're like washing our hair and then it's dripping down our entire body. There's just a lot of contact.
Okay.
I'm going to prioritize that where if you burn a candle once a month, we'll get there. But let's do the things that you're doing every day. Let's address those things first. And that might be perfume, might be shampoo, conditioner, body wash. Also, if you have small children, that's another place where I'm going to say, let's start to do the audit of your products there because if you're using bubble bath is one I think about a lot, like you are soaking all of your very absorptive skin surface in this
Chemical.
chemical, really. So let's think about what that looks like. And I help my patients to create a hierarchy of what we're going to do first. It looks different for everybody. What I have found is that there's so much awareness around these exposures these days that there's pretty easy to find affordable and accessible replacements for most things. Where when I first started on this journey 20 years ago and I wanted to replace, it was like you had to go to the health food store and get the deodorant that didn't work and the makeup that looked horrible and the shampoo that made your hair look so stringy and gross. Now you can find amazing replacements for almost anything. And I usually tell people, if you want to start to do your audit, go to the Environmental Working Group Skin Deep database. Just Google it. You type in your product. It gives you a rating 1 to 10 so you can understand the toxicity. And then if you need a replacement, just send me a DM on functional fertility. I have found replacements for everything. I've been through the ringer trying them all. I have all the skincare and the makeup and the hair care and everything you could think of. I have found a good replacement.
So, are there brands of hair care and body wash that you particularly love and you find that they are pretty fertility slash mitochondrial friendly?
100%. I'll just give you maybe a couple of my favorite things because it's
Yeah,
so fun.
absolutely. And these are not sponsored, you guys. These are just like the products that Dr. Wattles loves.
Yeah, I wish. If any of you want to sponsor me, please reach out.
Holler at your girl.
Nothing is sponsored here. So for hair care, I have two little girls, so I think about this all the time too, just like wanting to protect their hormones. We use Inner Sense. This is a
Okay.
great brand. It's so nice. They even have it at Ulta now. If you like live near an Ulta, you can get Inner Sense. They have a full range of hair care, so that's one that we really like. And then for I love an oil cleanser. So oil cleanser, a cream, body oil, deodorant. I use Primally Pure. Maybe folks
Mhm.
are already familiar with that brand, but their products are so effective. And I really appreciate that because not all like clean brands work the way that we want them to, but Primally Pure is a favorite of mine. For makeup, I use a foundation and a concealer and a blush that's by the company called Araza. It's just really beautifully formulated, all kinds of makeup products that are not only do they look nice, but they're also so nourishing to the skin. So that's a favorite of mine. And then I have the other brand that I've been really loving lately is maybe people are already familiar with Avocado Green. They make mattresses and they make pillows. We
Oh,
just
yeah.
replaced our pillows with Avocado Green and they're so comfortable and they're so nice. So there's a million options out there. I even have a PDF. Maybe I should put that on my website so everyone can download of my favorites. So I'll put that on there and you'll be able to see all my favorite brands.
Oh, and we can link that in the show notes for people as well. So I'm a big
Amazing.
fan of Primarily Pure as well. I used to be in a partnership with them and I had a savings code for people and it's still actually maybe active, but a brand that I love for skincare is Cocoa Kind. They're plant-based
Yes.
and I
Yeah.
find that they have truly transformed my skin. So I got married last year and obviously skincare, I wanted to look good in my pictures. I was really focused on getting my face to a place where I felt very confident and I didn't want to wear a lot of makeup on my wedding day. And I was able to achieve that. And I switched pretty much to completely cocoa kind products. They don't make a lot of actual makeup. So you're not going to find mascara and blush and eyeshadow, foundation at Cocoa Kind, but skincare they do. And I absolutely love it. And I trust them wholeheartedly. They're a very transparent brand. They're woman owned, which I absolutely love. And they're very eco friendly. So they're always talking about their packaging and how they're trying to reduce their waste and how they're trying to balance being eco-friendly with not driving up their price so that it can stay an affordable product for people. And as a consumer that is trying to become more and more health conscious, I'm very aware of that and I really appreciate that transparency.
And you can get it at Target
Yeah,
too,
you
which is
can.
so
Yeah, you
nice. And you don't
can.
have to order and wait. You could go get it right now if you wanted to.
Yeah, you can. Okay, so question about the supplements. You had mentioned I start you at a lower dose of CoQ10 and then we work
Mhm.
up. What are you working up towards 600 milligrams for? Are there side effects that we might see with CoQ10? And then with the other supplements, are there other side effects that we may see as well that people need to be just aware of if they're going to implement this?
Yeah. The reason I work up with the CoQ10 is not because anything inherently about the CoQ10 will cause side effects, but often the capsules are made with medium chain triglycerides. And if anybody has ever used MCT oil in their coffee to make bulletproof coffee or something like that,
Oh,
it can give you some loose stool if you're not
diarrhea, yes.
careful. Mhm. And so sometimes we need to acclimate a little bit to our MCTs. So I'll say you start with your 200 milligrams. You do that for a week. If you don't have loose stool, go ahead and increase. And then we build our way up just to make sure we're going to be comfy in the GI system.
Not pooping our pants trying to have a baby.
Not glamorous. You'd be like cursing my name that I did that.
Nothing ruins a supplement more than a bad side effect that you weren't expecting and weren't prepared for.
Absolutely. And oftentimes it's just, okay, how do we dose this differently? So NAC is another great example because I talked about how much I love that one. Sometimes that can make people feel a little nauseous. We typically say take it away from food. And so
Oh,
people take it away from food and they're like, oh, I feel a little nauseous. So I'll say, you know what? Take it with food. I'd rather you take it with food and take it than not be able to take it at all. We work with it. Other supplements, I would say one that I didn't talk about yet, but one that I love is Myo-Inositol. We love inositol. It's a powerful antioxidant. I like a powder that I do before bed because it can also help with sleep so much. Inositol is designed to lower insulin. And if someone already had struggled with low blood sugar, low insulin, I might not use Myo-Inositol, but most of these things are going to be really safe. There's not a lot of contraindications. The caution that I will, I guess, say is turmeric. So a lot of people will read about turmeric on the internet. And I don't use turmeric so much for my fertility patients because we see that high doses of turmeric in the luteal phase or at the time of implantation can sometimes impair that implantation process. And I don't even want it to be a question in anyone's mind. There are so many other anti-inflammatories that I can use. So turmeric is one that you might see on the internet. It's not my favorite if you're actively trying to conceive.
are there any other health conditions or medications that are forefront of your mind where you're like, yes, if you have this condition or you're on this medication, be very careful or just be aware and talk to your provider about it?
Not so much. I guess I'll say a lot of my patients have hypothyroidism. And so
Okay.
they are taking levothyroxine,
Okay.
thyroid hormone replacement. And sometimes we find that as we are lowering inflammation, we are making someone more insulin sensitive, we are supporting mitochondria, their thyroid function gets better. So we
Mm.
monitor because sometimes they can get to a place where they're like, I feel kind of overstimulated now because their thyroid function has improved. And so sometimes we actually need to back down on their thyroid medication. So that's one scenario. I do use this with caution in those who are on insulin. If you're a type 1 diabetic and you're taking insulin, we want to be really careful with supplements that alter your glucose transport and glucose dynamics. So that's an area where I would really work with your endocrinologist. It can be done, but we want to watch things carefully. And then this isn't really an issue with the supplementation, but If you're someone who also takes NSAIDs quite often, you're like taking pain medication because you have menstrual cramps all the time, that is something that can cause some damage to the mitochondria as well. So in that case, I would want to say, is there any way that we can reduce use of those medications and work on things like magnesium and lowering inflammation and helping to support your estrogen metabolism and doing all these things to reduce the pain so that you don't have to rely on those things so much?
So it's interesting that you brought up magnesium because that is what entered my mind when we were talking about the GI upset. I was like, oh,
Yeah.
just like magnesium. Sometimes
Yeah.
you can start magnesium too fast, too quick, too much,
Right.
and it can give you diarrhea. How does magnesium supplement, or does it support our mitochondrial function and or health?
Yeah. I don't want to give anyone flashbacks to their biology class if they ever had to take an exam and they're like getting traumatized from me saying this. But if you remember the TCA cycle, it's fine if you blocked that out of your memory, but it's basically
PTSD.
the cycle by which we make our cellular energy, and magnesium is required for that process. It
Oh,
participates in that process. And so magnesium can really help to support our mitochondrial energy production, and it helps us sleep, which is really important for our mitochondria as well. So magnesium is amazing. And I always tell people magnesium citrate is one of the most laxative forms. And so if you are constipated, let's use magnesium citrate. If you're not so much constipated, but you have muscle soreness or you have menstrual cramps or you just need to sleep and to relax, I might use a magnesium bisglycinate. Some interesting research coming out that if you have pain related to endometriosis or tightness in your pelvic muscles, that magnesium malate might be the right form. And then if you have brain fog or trouble studying or trouble with recall, or you just feel like you're not as sharp, your brain isn't as sharp as it used to be, I might do magnesium threonate. So there's all kinds of forms, and we can customize that too.
yeah. Okay. And you had mentioned previously about a gentle detox. On detox,
Mhm.
get horrible reps online, right? Everyone's,
Yeah.
oh my God, don't detox. Talk to us about what a gentle detox A might look like, and B,
Yeah.
what might we use it for?
So for me, especially if you're in the preconception time frame, a detox needs to be largely food-based. I'm not
Mm,
doing any really intense cleanses. It's not appropriate at that time. If you've already decided, I am going to get pregnant, I'm actively trying, we don't want to mobilize toxins into the bloodstream. So when we do really intense detox programs, the goal of those programs, if it's heavy metal detox or mycotoxins or anything really intense, the goal is to mobilize those compounds into the bloodstream so that you can release them in the stool or in the urine. And we don't want all of those circulating toxins when we get pregnant or when
right.
we're ovulating. We want the development of our egg cell to be in a setting that's pretty low tox. So if people have really significant environmental exposures, we have to have a really crucial conversation about what this timeline looks like, because I want to do the detox and then have a separation probably of about 3 months after we finish
Wow.
that detox program. Because if we think about the way an egg cell matures, a very small immature egg cell called the primordial cell, that development process to what we call an antral follicle, that is a cell, an egg cell that's big enough to ovulate, that process is going to take about 3 months. And I want that process to happen in a very low tox environment. What I am comfortable with in that time frame is a very gentle, I don't even want to say detox, supporting our natural biotransformation capabilities, our body's natural inherent ability to remove toxins. Number one, that means dietary fiber, and
Hmm.
not just dietary fiber, but specifically insoluble fiber. So that's going to mean oats. I love sprouted oats, are some of my faves. It's going to mean lots of cruciferous vegetables, broccoli, cauliflower, kale, Brussels sprouts. Lots of, I would say, brightly colored fruits and vegetables in general because they're very fiber rich. And the thing about insoluble fiber, I also should say beans and lentils, and apricots is another good one. These types of fibers, they like form a gel in our reproductive tract. It can bind different environmental toxicants, and it forms, it's bulk forming. So it supports you to have regular bowel movements, take those environmental toxicants out. So dietary fiber, Like I said, cruciferous vegetables are inherently detoxifying. Even green tea can really support our detoxification pathways through the liver. As a high dose, it has to be about 3 cups per day, but that's fine. If you spread it throughout the day, you can even ice it. It's super great antioxidant. And really focusing on some of the lifestyle pieces. So if you are constipated, you're probably more toxic than you need to be. We have to have a bowel movement every single day, whether that's because the fiber will help, the magnesium will help, eating or staying hydrated will help. So half your body weight in ounces of water. We have to make sure that we are having a bowel movement every day. Sweating, doing things like dry brushing, all of that is going to be really gentle and effective. Having enough dietary protein. We have to have protein both to support the lining of our gut, to support our detoxification enzymes, which often rely on amino acids. There are very gentle dietary and lifestyle hacks that we can do. Some people, if they have really severe exposures, like I said, to heavy metals or something like that, will have to approach that with a lot of care.
Yeah. It's interesting to hear you say about the constipation that if you're not pooping often and regular,
Mm-hmm.
it makes sense that the toxins are just built up because
They don't have anywhere to go.
pooping exactly is the pathway to rid your body of that. And it's one of those natural pathways that your body's just designed to get rid of the toxins. That is so interesting to me, especially because I know that a lot of Americans are chronically constipated. We just don't know how to poop. And I also think that a lot of our lifestyles, whether it be diet and lack of exercise, lack of movement, or whatever it may be, really facilitates constipation. It almost sets us up to be constipated.
Yeah, almost everyone is constipated. And so we had to
Mhm.
use these things. Castor oil packs, I should have said that one too. Castor oil packs are excellent for supporting for us to have a bowel movement. And I use a therapeutic elimination diet in my practice quite often. It's just a very temporary 3-week comprehensive elimination diet. It helps to lower inflammation. It really helps for those who have autoimmune disease, really helps for those who have insulin resistance. But it's detoxifying in nature. I will not do it unless someone is having a regular bowel movement because I don't want to stir anything up and then it's stuck. It has
And
nowhere
they're
to go.
not going to be able to pass it.
Exactly.
That makes so much sense. If someone was getting fertility treatments and they wanted to talk to their doctor about mitochondrial health, and their doctor hasn't brought this up yet,
Yeah.
how would you suggest that they bring this up and they start to broach this topic with their provider, assuming that their provider knows about mitochondrial
Mhm.
health?
My number one suggestion is probably just to ask if you're working with, let's say, a reproductive endocrinologist to say, are you comfortable if I take CoQ10? If that's not already on the table, start there. I think that is my number one priority with everyone. So ask, are you okay if I work with some CoQ10? The other thing is, this is a great opportunity to work with a functional medicine provider, right? This is where my bias is going to show because I love the functional medicine collaborative care team. So you can work with someone like me. You can also, if you want to work with someone who's locally, I always recommend that people go to the Institute for Functional Medicine website at ifm.org. You can type in your zip code. You can find a functional medicine practitioner who's near you. Mitochondria in functional medicine, we work with systems biology, and that means we are assessing everybody's unique body systems. And just to give you the 30-second summary of what that means, we use a tool that's called the functional medicine matrix. So for every single patient, we are working up assimilation, which is your gut health, defense and repair, which is your immune system, chronic inflammation, and chronic infection. We are looking at energy, which is mitochondria, biotransformation and elimination, which is all the toxic stuff we've just talked about. Transport, that means your blood flow, your lymphatic flow, and then glucose transport, so metabolic health. We're looking at communication, which is hormones and neurotransmitters, and then we're looking at structural integrity. And that's big structures like your skeleton, all the way down to tiny structures like your cell membranes that, for example, allow your brain and your ovary to communicate. So because energy is built into the functional medicine operating system of how we were all trained, we're going to feel, many functional medicine docs are going to feel really comfortable to support your mitochondrial health.
Are there things that would lead you to believe that someone has mitochondria dysfunction that when you look at someone or you're talking to them that is not hypothyroidism and that's not
Yes.
PCOS, where someone like me who is not super familiar with this may just write it off as that's my body, that's how I've always been, or this is my normal. For you, are there red flags where you're like, you know what? That's not normal. I want to look into that further.
Yes. Everything I'm about to say, you are going to, in your mind, think that could be five other things. Yes.
Okay.
Yes, it can be five other things, which is why it's so important that we're doing a comprehensive lab evaluation as well. So it can be fatigue, right? Sometimes mitochondria, they make our cellular energy. So doesn't it make sense that it would just be fatigue? Now, I
Mm.
know what you're thinking. That can also be iron deficiency. It can also be a billion other nutrients. It could be
Who's
hunger.
not tired these days, honestly?
Who's not tired? Which is why we probably all need a little mitochondrial support, right? So it could be fatigue. It could be chronic pain, like fibromyalgia is a great example of what's this kind of nebulous diagnosis. And people are like, what is going on here? Oftentimes, the root cause is mitochondrial dysfunction. It could be migraines. A lot of my patients with migraines need a lot of mitochondrial support. And that's one of the linkages between chronic migraines and infertility is that they share mitochondrial dysfunction. That's one of them. Another thing is insomnia. If you know for a fact already that you have a history of iron deficiency, our mitochondria really need iron. So I'm going to be a little bit suspicious about your mitochondrial function if you have low iron. If you have any, even if I would say even a family history of neurodegenerative conditions, so things like Alzheimer's and Parkinson, just cognitive decline, I really want to be aware of your mitochondria. If you have hypertension, if you have diabetes or elevated blood glucose, if you're someone like me who I had pregnancy-induced hypertension in one of my pregnancies, anytime we have a history of elevated blood pressure, hypertension, gestational diabetes too, I want to be thinking about your mitochondria. So it can be hard because it looks like a lot of different things, but it any of these signs or symptoms are going to raise our index of suspicion.
Yeah. Cortisol has become a hot topic, right? It's
Yeah.
everywhere. Everyone's talking
Mhm.
about high cortisol, low cortisol, reducing your cortisol, how to know if you're over cortisoled.
Yeah.
How does cortisol, both regular levels and too much, impact our mitochondria health?
Yeah. Ooh, this is a great question. Cortisol is really having a moment, isn't it?
It
Like
really is. It's
everybody's
cortisol's
talking
time to
about
shine.
cortisol. Yeah. Cortisol is interesting because it has so many functions. So I think, first of all, I want to say cortisol gets villainized and for good reason, because too much cortisol definitely has a number of adverse effects on our health. But at normal levels, cortisol helps us to maintain our blood sugar. It is anti-inflammatory. It helps us to remain resilient and to get up out of bed in the morning and take on the day. So cortisol is not the bad guy. It's when we have these chronic elevations of cortisol that are an issue. They can cause us to have, so if we think about, I always use this silly example, but it works in my brain. Let's say we're running from a dinosaur or running from a tiger, right? It's stressful. Our cortisol is going to spike. And one of cortisol's jobs is to release glucose into our bloodstream so that we have the energy available to
Yeah.
run. So for good reason, cortisol will increase our blood sugar. It was designed to do that. But when we are responding, we're in this culture now where it's like everything feels like we're running from a dinosaur. Opening our email, our phone has a text message sound, like someone knocks on the door. Everything is triggering our nervous system because we're so overstimulated. So many of us have this very chronically elevated cortisol that can increase our blood sugar, can make it hard for us to maintain our lean muscle mass. It can interfere with the hormones that come from the brain that tell the ovary to mature an egg cell. So our brain talks to our ovary through these hormones that are called the gonadotropins. It's follicle stimulating hormone and luteinizing hormone. Cortisol can interfere with those hormones so that we're not maturing our egg cells as effectively. We might have more anovulatory cycles. The other thing that I think, if I can make the linkage to mitochondria, with cortisol is produced by our adrenal glands, as is DHEA. And DHEA, it's an androgen hormone. It is extremely important for egg cell maturation. And so depending on where we are in our stress response, sometimes if we have like chronic stimulation of our adrenal glands, they can start to lose some resiliency and our DHEA will drop. Our DHEA does drop anyway after we're like 25, which seems really unjust to me, but that's how it is. But when we have this chronic stress, our DHEA can get lower and lower. And DHEA is very much a stimulator of mitochondrial energy production in the ovaries. And so as DHEA drops and drops, we can have issues maturing our follicle. So I measure DHEA sulfate in the blood. If it's low, I will start repleting it, starting at a very low dose, working my way up, monitoring as I go. I also do a 4 or 6 point salivary cortisol test. So you take your little saliva sample throughout the day so that I can see how cortisol is behaving, because we want cortisol to be high in the morning, right? That's what allows us to wake up, to get out of bed, to meet the needs of the day. And then cortisol should fall so that it's at its lowest point during the night, where its counterpart, melatonin, takes over. So while cortisol is the hormone of the light, melatonin is the hormone of the darkness, they are opposing. I want to see how cortisol is behaving, because sometimes our cortisol is low in the morning and high in the evening, so we can't get out of bed. And then in the evening, we're all overstimulated and can't sleep. We just have to see how cortisol is behaving. There's clearly so much we can look at and investigate.
So that sounds very much like me. In the morning, sometimes I wake up and I'm like, I don't even feel like I have slept at all. And then I often will joke that my most productive work is between 10 p.m. and 2 a.m., which earlier in the episode, you said that's where all of your melatonin should be spiking. So if someone has high cortisol and we're seeing not that drop in cortisol at night, can we retrain our brain and our hormonal output by supplementing with melatonin? Is it like a crutch and we say, all right, here's what you should be doing, and your brain can catch on to that?
The melatonin is going to help. It's one small piece of the puzzle, right? It's going to require in some cases, pretty radical lifestyle change too.
Okay.
So sometimes it might be we get up in the morning and you need to have bright light exposure right away. That is going to feed back to your brain that it is time to be awake. It's going to help to repattern that circadian rhythm. If you exercise and you have this pattern that you're describing, I'm going to say exercise in the morning, because exercise raises cortisol. It's supposed to do that. Cortisol is going to help to be anti-inflammatory in your muscles after you exercise. But that's going to tell me I want you to exercise in the morning. Afternoon, we are done with high intensity exercise. Maybe a gentle walk, but we're going to exercise in the morning. If you have caffeine, we're going to prioritize that in the morning. No caffeine after maybe 11 o'clock, 11 a.m. or noon, if you have that pattern. We're also going to have to do probably some mindfulness practices in the afternoon. So I really like a guided imagery, but really trying to get that cortisol response down in the afternoon. And then for some people, we have to use some extra supplements. One thing that I use is called phosphatidylserine. This is essentially a cortisol blocker. It reduces the half-life of cortisol. So for some people that have that cortisol spike in the evening times, I'll have them take phosphatidylserine as they're gearing up maybe after dinner to lower that cortisol response in the afternoon. I also use adaptogenic botanicals, which help to us to maintain homeostasis. And there's all kinds of different choices that we could probably dedicate a whole episode just to that. But it's usually a combination of lifestyle, changing your routine, maybe adding some supplements, melatonin being one of them.
Yeah, so cool. All right, I think my last question revolves around age. So we keep talking about the older we get, this happens. The older we get, our eggs are not as great. The older we get,
Mm-hmm.
is there anything that we should be worried about earlier? So people who are in their early 20s or in their mid 20s, I feel like for me especially, none of this was on my mind at all. I never considered it. So if there's anyone out there listening and they're thinking, I don't have to really be worried about this now because I'm 23, or I'm 26.
Mm-hmm. Mm-hmm.
What are some things that those listeners might need to just flag in their brain and or might need to be considering for where they are in life now?
Yes. So I always feel so honored when I get someone in the office and they say, I'm not quite ready to try to conceive yet, but I want to be really proactive about this.
Yeah.
Because It's really frustrating when you wanted to get pregnant yesterday and now we find some things that aren't ideal and we have to take the time to fix it, right? It's really disheartening. It's really frustrating. So if you're in your 20s now and you're like, what can I do to support my fertility? Find a practitioner who you want to work with who's willing to do a preconception analysis. So I have a whole preconception panel that I do in blood work. It's 32 different biomarkers at this point.
Okay.
So what that looks like is I'm going to get you in on cycle day 3 to do some lab work. So I do lab work at 2 different times in the cycle. I do lab work on cycle day 3, and I do lab work about a week after ovulation.
Okay.
So on cycle day 3, we are going to get you to the lab, and that is going to be the place where we start to look at markers of ovarian reserve. So we can't measure exactly how many egg cells are in the ovaries. There's no like blood test to tell us exactly how many egg cells are in the ovaries. But what we can do is look at some indirect markers of ovarian reserve. So all of that to say, on cycle day 3, we're going to do follicle stimulating hormone, luteinizing hormone, estradiol, and anti-Müllerian hormone. And those are going to be our markers of ovarian reserve. Because you're already going to the lab, I'm going to do a couple other things at that time. I'm going to do testosterone.
Okay.
I'm going to do DHEA sulfate that we talked about because our androgen hormones are so important for egg cell maturation. And I'm also going to measure a hormone that's called prolactin. Prolactin comes from the brain and it can interfere with ovulation and egg cell maturation. So we're going to do that. We're going to do a full thyroid study. That means thyroid stimulating hormone. It's the message that comes from the brain to the thyroid gland to tell the thyroid to make thyroid hormone. But we're going to also confirm that the thyroid is responding by measuring our free thyroid hormones, free T3 and free T4. I'm also going to do a screening for autoimmune thyroid disease, which is anti-TPO and anti-thyroglobulin antibodies. And this is a big one because autoimmune thyroid disease can affect our egg cell maturation. So this is something that I would want to know about well in advance of when you're trying to conceive so I can deal with it. I can understand what are the triggers to your immune system, and I can help to support you through that. I'm going to do a bunch of metabolic markers, a complete blood count, looking at red and white blood cells. I'm going to do a comprehensive metabolic panel and something called GGT that's going to help me look at your liver and kidney function, make sure that your liver is able to process these environmental toxicants that might come into contact with. I'm going to do a fasting insulin. I'm going to do a high sensitivity C-reactive protein, which is my favorite inflammatory marker. And I'm going to do a lipid panel. And this is going to allow me to screen for insulin resistance, which we've talked all about how that can impact your fertility. It's going to help me to understand your total body burden of inflammation so I can figure that out well in advance and prevent, like I said, that wasting away of your ovarian tissue. I'm going to look at some nutrients. So we're going to do a ferritin, an iron, and a total iron binding capacity. Iron status is so important because it is iron's job to deliver oxygen to all of our tissues, including our ovaries, including our endometrium, not to mention like our brain, which is very important. But chronic iron deficiency can cause, it's hypoxia. It's a lack of oxygen to those tissues. So that is very detrimental. We're going to look at vitamin D, B vitamins, homocysteine, uric acid, which is a really important molecule. Doing this preconception panel not only is supportive of your fertility so you can get pregnant easily, have a healthy and safe pregnancy, bring home a healthy baby, but it is going to reduce the risk for chronic disease 20 years down the road. Things like breast cancer, osteoporosis, cognitive decline, diabetes. This is an investment in our health. So this is clearly my call to action. If you're 25 and you're listening to this, please come see me so that I can support you and you can have a baby when you're 38 and you're feeling ready and your body will be so resilient.
And it must reduce the risk of miscarriage and pregnancy losses because we've already done the groundwork. I know for me, that's where I am currently in our fertility journey is we're not ready to conceive now or even yesterday or even
Yep.
tomorrow, but I recognize in myself, I have a lot of self-awareness that for me, you can even hear my voice cracking a little bit because it makes me very nervous. I have seen my best friends, I have seen family members, I have seen clients experience loss. And for me, I know that will destroy me. And I want to do everything in my power to I know you might not be able to avoid it completely, but I want to do everything in my power to reduce the risk. So if I can
Mhm.
improve things before we try and conceive, that's what I'm doing now. And so I've talked a little bit online about what we're doing in terms of my husband's health and lifestyle changes there and what I'm doing in my health and practitioners I'm working with. And so it's really comforting to know that even if you're not ready to conceive right in this moment, there are still actionable steps that we can take to be improving our success rate and to reduce the risk of hopefully emotional trauma and losses in our future.
100%. And thank you for mentioning that your husband is doing things too, because we didn't even touch on male fertility. That is a whole topic on its own. But I offer a male fertility assessment as well, because we know that men's metabolic health, their level of inflammation, their even insulin resistance can impact the health of the offspring as well. So it's really important that both partners are deeply invested in the process, that they're doing the lab work, that you're modifying all the lifestyle factors. And that's, if I can just say one last piece of praise for functional medicine, that's why I believe in it so much, because it's the body systems approach. But at the foundation is always the lifestyle factors: nutrition, sleep, exercise, stress management, and relationships. And we just can't forget about all those pieces for both partners.
Yeah, super, super, super important. I think a lot of times, unfairly, women get blamed for fertility issues, and we know that it's 50-50. Your male partner is just as much a factor in fertility as you are. And it could definitely be female factored fertility, but just as easily it might be male factor fertility. And for some reason, that just hasn't gotten the light that, in my opinion, I think it deserves. And I think that women carry a lot of that burden. And not only does that hurt emotionally, but I think it hurts the fertility industry because we're not looking at the whole picture. Very often, we're just looking at the female and we just assume that the man is okay.
Mhm.
And we just assume that the sperm is healthy.
You and I will spread the word then, because we got to turn the tide on this one. Men absolutely need a fertility assessment. And I'll even add, I hear from a lot of my male patients, maybe they've had a baby in a previous relationship and they're like, I've already fathered a child. I'm good. I know it's
Oh,
fine. But so much can change over time. Our mitochondrial function change, our level of inflammation changes, even things like a varicocele, which is this kind of enlarged vessel in the testes that generates a lot of heat. It can cause sperm DNA damage. So many variables can change that I say, if I have a semen analysis that's over a year old in my patients, I will ask them to repeat it and I'll have
wow.
them do a sperm DNA fragmentation. I use a company called Legacy. Maybe your fertility clinic will offer this to you, but there's lots of different ways. But I'll repeat a semen analysis because I don't want to guess. I would never guess for my female patients, so I'm not going to guess in this department either.
I love your approach of test, don't guess. It just feels so aligned with me. And I know that so many of our listeners also are going to really appreciate that. Dr. Kalea, this has been such a good conversation. I feel like I came in a little unsure about what we were going to talk about. I didn't really know very much. I talked about at the beginning of the episode, like the mitochondria is the powerhouse of the cell, and that's the extent of my knowledge. I feel super empowered now at the end of the conversation. I feel like I really understand at least a shallow piece, a surface level of mitochondrial health. And I feel like I really understand how important it is to start to plan and prepare for family planning and expanding your family months before you're actually trying to conceive. So thank you so much for being here and sharing your knowledge and helping all of us just understand what is happening in our body on truly a cellular level. If anybody was wanting to connect with you or something you said really stuck with them or people wanted to work with you after this conversation, where can people find you and what kind of services and programs do you offer?
Yes, thank you so much first for having this conversation. You're a wonderful host, so easy to talk to,
Oh,
which I so
thank you.
appreciate. You can find me at any time on Instagram at Functional Fertility. I am always putting out free content because I believe in the functional medicine approach to fertility with my entire heart. So find me at Functional Fertility. If you'd like to learn more about working with me, you can also head to drkaleawattles.com. If you're interested in seeing me as a one-to-one client, you can book a free exploration call. We'll just chat, get to know each other, hear about your goals. I'll tell you about the practice. I also have an online program. It's called the Functional Fertility Blueprint. It's 8 modules. They're on demand. You can go on there. Module 1 is learning all about cycle charting. So figuring out how to chart your cycle, how to identify if you're even ovulating, how to confirm you're ovulating. And then the second module, I think, is where this audience might be most interested after our conversation today, because I mentioned the functional medicine matrix. And this module has tools and quizzes and all of these strategies to help you build your own functional fertility matrix. So you know exactly which areas of your body need to be supported. And then there's all types of educational material around those areas so that you can really feel empowered to take charge of your own health, your own fertility. We talk fertility supplements and men's health and all the labs that you'll need. It's really the most comprehensive way that I can support you on your preconception journey. So that is available. You can find my podcast, the Functional Fertility Podcast, wherever you stream, wherever you're listening to this show, you can listen to that one too. And I just look forward to connecting with all of you. And I'm so grateful for this opportunity to talk about what I love most.
Absolutely. Thank you so much for joining us today. All right, you guys, I'll see you in the next episode. Be sure to follow Dr. Wattles on social media, and you can find me at Tranquility by HeHe and at the.birth.lounge. Until next time, head to your app store and download the Birth Lounge app for evidence-based childbirth education and data-driven postpartum support delivered straight to your phone. Bye. Thank you so much for tuning in today. I truly do value this community and I love hanging out with you. You deserve to have a birth that you love with a provider that values your autonomy and respects informed consent. It's an honor to be your go-to gal when it comes to preparing for your baby. If you found today's episode helpful, share it with a friend. Share it with someone who could use evidence-based information to help them have an informed and confident birth. I'd love to hear what you have to say and read your sweet words. By leaving us a review, you are helping other expectant mamas and their families find the podcast so that we can reduce birth trauma and improve maternity care in the U.S. one birth at a time. If you're interested in joining the Birth Lounge, go to thebirthlounge.com. If you want to connect with me on socials, you can find me at Tranquility by HeHe on all platforms. Until next time, stay educated, stay supported, stay confident. Bye.